Well, the first thing that went through my mind, and I, and I think with a lot of things that are serious like this, is that it never will happen to you. I thought this can't be happening to me. It always happens to somebody else. But after a few weeks of kind of coming to grips with it, it was kind of a turnaround. I said, I'm gonna fight this. I'm gonna do the best I can to get better, and that's what happened. I was recommended to go through physical therapy after the surgery, and I think that was one of the big reasons that I was able to recover my incontinency so quickly, was through this physical therapy. So I'd say that the center here was, you know, second to my wife and her support. Support groups, that is very, very instrumental. I think it's a very good program. My wife and I attend the support groups whenever we can, which is probably 9 out of 10 that are held, and we enjoy sharing our results with those people that are just recently diagnosed, or those men that are recently diagnosed with prostate cancer. I can say that I've gone through it. I know what it's like to have cancer. I know what it's like to just wake up and say, you know, this, you know, life, you are mortal. I mean, you will succumb one of these days, and you don't know what it is. But I think it builds some character. I think it builds confidence in what you can do. It's a life changer.
I was surprised because my PSA level was so low, and I could not believe that it was anything more serious than just, if you will, a nodule. And when they did a biopsy, they found that it was malignant. And like a lot of patients, I was given the good news and the bad news. The good news, because of my health and my age, I was a candidate for any one of 5 different treatments. The bad news was I was a candidate for any one of 5 different treatments, and then I had to make a selection. Part of my experiences as a cancer survivor gives me the benefit of at least talking to people about what's important in life, what's valuable in life, and you know, like the old saying, don't sweat the small stuff. Now, I had a tendency, to be honest, when I was first diagnosed, to want to keep it from my wife and to keep it from my family. But then, because of the support I got, I realized that it was important, if you will, to share this so that they could be at least in my corner. I would offer, as I have, to some of the folks that I've sat in support groups with, if they wanted any personal discussion, I'd be glad to do that.
My initial impression after learning that I'd had prostate cancer was, what should I do to get the best result in terms of a cure? And thought initially about the robotic surgery, which I had heard some things about, did some quick reading on it, also did a look in the, on the web for some of the physicians in the Denver area that actually did the procedure. My feeling was that there was going to be less pain and less time to recovery overall. So my decision was to just go right into having the robotic surgery. One of the things I would say to any individual out there, males particularly, is that we should be checked, or to be very well aware that prostate cancer is a possibility, and particularly in black men. So it's something that I would say to anybody, make sure that you get those checkups to find out just exactly where you stand, because the cure isn't as difficult as you might think if you find out early. the facility at TUCC, I think that the big thing that stands out is that there is a warmth, and I think that extends all throughout their organization. Certainly they care, and it's not just specifically because you may or may not have a disease state that they're treating, but I think that from the entire staff, they seem to care. There's a warmth that's there that they share. And just the actual contact that you have in those day-to-day activities, there's a caring there.
And they're going to tell you what the time frame is, what the possibilities are, what the good parts are, what the bad parts are, and I would tell you there are very little surprises. But I had a couple. So I'm pleased to say that Monday's my final day, tomorrow, and I'm going to run away on a Queen Mary. I feel pretty good. I have the side effects that come along with it in terms of urinary and bowel irritations, but it's a small price to pay for taking the cure. I think that the comfort that you feel when you come here, you're always greeted at the door. The girls always tease you. They're wonderful. I would say that it's an expected process each day. It's the same, and they know what they're doing. I don't think of myself as getting ready to pass. I don't think I wasn't unhealthy when I began the process. I am not unhealthy now, other than minor side effects, and I intend to recover. I am not, I've never thought about it in terms of survivorship because I wasn't ready to go.
Well, not knowing what the treatment was going to be like, I mean, the nurses just made it so easy. I mean, it was so pleasant. It was simple. I walked in every day for 43 treatments. I walked in and laid on the table in the big machine, put me on the big machine, lined me up, and it was like 15 seconds per dosage, and 6 different spots around the body. And it was just in and out easy. Go on the internet and learn as much as you can. And it took me about, I want to say about 6 months to decide which treatment, because it was diagnosed early enough. So it took me about 6 months to decide which treatment to go through. I think you're right. I think it makes me feel like I was able to beat something. I was able to win. You know, being a competitive kind of guy. I think that having said that I've beaten cancer it is really very empowering. Men have a tendency to be bullheaded about their physical bodies and things that happen to them, and just go get it checked out, and to find out early enough to get the early stages. And when the earliest stages, then you really have the options. But if you let it go on and on before you get it diagnosed, then your options are limited. And that's one thing about life, is we like choices. And the early enough, the more choices you have.